Welcome everyone. My name is Dr. Manish and we are going to make a small video and we are going to discuss about a case. This is random case discussion from Burnett, what we have learned. So now I will take the camera to one of our colleagues, Dr. Thiron, and he's going to talk about a wonderful case. Just we cured it. He gave some medicines. What was his thinking process? How did he give? What was the things that he observed? First we'll listen from him and then we'll connect it with the Burnett theory. So here is Dr. Thiron, and Thiron, you had discussed one case, right? You cured one case recently. It was a case of elderly man and UTI, right? A very tough case. So can you just brief what happened exactly and what did you do?
Yeah, he came to me after already taken homeopathic medicine. So he came to me with a UTI complaint, with a burning maturation at the closure end of urination. So it's a more symptoms like sarsaparilla. So I told him to take sarsaparilla, but sarsaparilla is not available there. So he took first as cantharis as a first medicine. Next day he got sarsaparilla, and he took sarsaparilla. He got improved actually. That day he got 70% improved.
So sarsaparilla, what was the indication of sarsaparilla that you gave?
End of urination, burning and a tingling sensation, itching in the urethra.
So he was having burning and itching at the closure of the urination.
Yeah.
That is the bold and the italics,
Italics.
in key as a keynote. So sarsaparilla was not available. So
Yeah.
you thought
So
of giving closer one because cantharis also has the burning at the end of the drops of the urination. Okay. But he got better with sarsaparilla.
Yeah, he got like a 20% improved in cantharis with cantharis. Next day he got improved like 70% with sarsaparilla. Next day he discontinued the medicine. Night he called me. He called that he was getting aggravated. Pain was increased. That time symptoms are changed. It's not sarsaparilla. So he is not giving the picture of sarsaparilla.
Okay. So sarsaparilla, 70% he was better, you saying. And in the night again pain started.
Yeah.
And now the totality changed.
Changes.
So it was not sarsaparilla at the closure of the urination pain. That symptom had gone.
Yeah.
Okay.
So I thought of giving him, what should I give? Like I thought of cantharis again. Then lycopodium already given by another doctor. It was not helping. So I thought of again sarsaparilla. It's not a picture. So I thought of his past history. Like he he had a urinary calculi. So then he also have TB, miliary TB in childhood, and in his family also there are many psychotic problems. So I thought of giving him medorinum actually, but medorinum is not available because of ureteric genitalia. So I thought of medorinum. Medorinum is not available, so I gave Tuja. 3 doses he took at night. Next day he himself called me and said that what should I take. I asked him, how are you and how much you got improved. He said it was surprising that he said he will get improved at 100% he was improved.
It's completely better.
Yeah. Then I asked him why you are asking to repeat the medicine. He said you yesterday night only I took na. So he asked me. So I asked him to take night Tuja again, next day night 1 dose. Then he got better.
Wow. And now how many days have passed?
4 days.
4 days. No complaints.
No complaints.
No discomfort.
I called him day before yesterday. He said he was okay. No problem.
And he's your relative, right?
Yeah.
He's your uncle. Mama.
Yeah.
What's his age?
38.
38. Okay. So look great. Sorry, I said that he's an elderly man. He is not. Okay. But wonderful case. Wonderful. So now this is a very wonderful case and we can really learn from this case. That was the purpose I wanted Dr. Thiron to come up with the case and give this recording. What do we learn? Let's see the sequence of the event, what happened. Patient called him for UTI and he was having a very important keynote symptom. At the conclusion of the urination, there was a pain. And of course, sarsaparilla is the remedy that is indicated. So what he did first, present predominant totality, the keynote symptom and the most important striking peculiar symptom on which he prescribed sarsaparilla. Patient got better, around 70%. Then what happened? Totality changed. In the night when he got the pain again, the totality completely changed. But yes, discomfort was less. Now sarsaparilla is not indicated. And then he must have tried. Of course, you must have tried, right? Totality taking. But totality was not coming properly. So what he did is that, very beautifully, he went to the past history. And he found out psychotic trait. When you read Hahnemann's chronic disease, Hahnemann says that uterine region, urinary region, when this region, sexual regions, this is one of the sphere of action of psychosis. Throat is psychosis. If you read Medorinum in Alan's keynote, second or third paragraph, he talks about ovaritis, salpingitis, fibroids, all female complaints, psychosis. Medorinum. So on that basis, beautifully, psychotic trait and the sphere of action also indicating psychosis, he gave Thuja. And Thuja completely cured. What is the point that I'm going to make it here? Burnett used to talk about this, and he has written very nicely that organopathic remedy or the totality based remedy, if it is not deep enough, many times if we specifically talk about organopathy, like sarsaparilla is an organ remedy, many times it is used as a specific remedy. Even Cantharis, many times we use it in UTI as a specific remedy. So organopathic remedies will relieve the symptoms, will calm the patient, might relieve, all the pain and intensity of suffering, it might reduce. But the real disease will not go, and the real disease is disposition. To cure this disposition, you need zoic remedies. That's what he says. Now, what are zoic remedies? Zoic remedies are nothing but the no-sodes, anti-miasmatics. So, the knowledge of anti-miasms, miasmatic remedies, zoic remedies can really help you in your cases in so many acutes and even in chronic and recurrent cases. It is not just like that at the end of the life, Rima Handley's book, it is said that Hahnemann at the end of his life became a miasmatic prescriber. So definitely, I hope this case might help you. I'm going to come up with some short cases like this from myself and my colleagues' practice so that it can help you gain more knowledge and get better results in your practice.